Welcome to MedAxiom HeartTalk, where thought leaders come together for one ultimate goal: to continually transform cardiovascular care for all. MedAxiom HeartTalk starts now.
I'm Melanie Lawson with MedAxiom HeartTalk, and today we are joined by Dr. Effie Andrikopoulou, and we are talking about the emerging applications of artificial intelligence in cardiology. So hi, nice to talk with you today.
Thank you so much for having me.
First of all, I think we need to tell all of our viewers that artificial intelligence, AI, is not a dirty word.
No, it's not. I like to think about it more as collaborative intelligence. It's not so much about what it is or how it can hurt us. It's more about how can we leverage it and use it to our advantage to make our lives easier. And by making our lives easier, we can give much, much higher quality care to our patients.
Yeah, it's all patient-centered when we tie it back in. So how are practices currently using AI, and what do you see as the biggest benefit?
There's a lot of versatility in terms of how we can use AI. AI encompasses so many different solutions and tools and softwares. It all comes down to each practice's specific needs. So depending on the needs of each practice, its health system, its hospital or organization, they can use different solutions. I'm a cardiologist and I'm a cardiac imager. And so I will be a little biased and talk a little bit more about how we can use it in imaging. And the way we can use AI in imaging is to help us automate detection of disease, automate performance of echocardiograms, cardiac CTs, cardiac MRIs, and help us detect disease much earlier, help us automate risk stratification and prognostication of disease. And in addition to that, it can help us build clinical workflows to standardize management of our patients, streamline clinical workflow, and help us build clinical programs to better meet our patients' needs.
Mm-hmm. You know, one thing that I know we've talked about in Heart Talk is that there's just so much data. And sometimes that's one of the roadblocks, is trying to figure out how can we leverage it, utilize it, and that we're using it in the most effective way.
Absolutely. There is a lot of data. We're drowning in a sea of data, and most of this data is unstructured, which means that it's not collected, documented, and recorded in a standardized manner. Most of it is unstructured. Think about clinic notes. Which is the vast majority of what takes up the EHR, the electronic health records right now. In addition to that, now we have a growing amount of data that's generated by patients. I don't like calling them patients, it's users, because most of these people are not really patients.
Okay.
By individuals themselves. Think about all of the mobile apps.
Right.
Think about the smartwatches that everyone is wearing. So we are now generating our own health data. And yes, we are drowning in a sea of data. AI can help us parse through this data, because obviously it's not realistic to expect a human to parse through all of this data. We are going to miss things. We do that all the time. To err is human, right? But can we use computers and machines to not err or to minimize errors? Mm-hmm. That's where AI can really shine, is to automate detection of certain data and integrate multimodal data that comes from different sources to make it make sense to us in an easily digestible, time-efficient manner.
We know that it's here, it's being utilized in some places more than others. What are some of the roadblocks and opportunities when it comes to implementation?
Yes, absolutely. Let's start with opportunities. Mm-hmm. I'll start with the positives and end with the roadblocks. With respect to opportunities in implementation, like I said, there's so much versatility in how we can use AI. It really comes down to what the needs and the problems are that we're trying to fix. And that's where the importance of having stakeholders have a seat at the table, allowing people to have a voice in speaking about their needs and problems. And that can be within the health system, within the organizations and hospitals, but also from the outside, from communities themselves, from the communities that we're trying to serve, from our patients and patient advocacy groups, in addition to our clinicians. Once we identify our needs, then it's time to set out to try to find the appropriate vendor, the appropriate AI company because most of the times we're not going to be able to make it ourselves, nor should we. That's not what we do.
Right.
So then we have to find the appropriate AI company, vet them, have a selection grid with certain criteria that we want for the solution. And then once we identify the solution, we have to implement it. Work with our informatics teams, work with our risk compliance, risk management, legal teams in our organizations to implement those. And then once we implement them, be able to monitor the outcomes and the progress and the ROI, the return on our investment,
Right.
in terms of both clinical outcomes, which is the most important, but also, I mean, we shouldn't shy away from this, but also financial outcomes, quality outcomes, equity outcomes. We want to use AI to, like we said, and I'm never going to be tired of saying it, to provide the highest quality of care to our patients. And that includes equity. We have to meet our patients where they are. We have to make our system patient-centric. And the big opportunity with AI is to help us shift the culture, shift the paradigm, and convert it from physician-centric to patient-centric. The important roadblock is the lack of trust, and for good reason.
Yeah.
One of the big reasons why we don't trust AI right now is, first of all, the black box nature of a lot of those tools and devices and softwares. And the way that we can resolve this is by us as clinicians, by advocating and requesting and demanding, I know it's a strong word, but I'll use it, and demanding a seat at the table. We have to reach out to those tech companies and say, hey, we want to sit down with you, and we want to be part of development early on. We want to know what data goes in, how data is being analyzed, and how the output is being generated, because this is directly affecting our patients and our lives as physicians. And then the other important roadblock is the cost. If only it were so easy to start using AI and partnering with third-party companies, we would all be doing it. We wouldn't be having this conversation right now. Cost is another very, very important issue. I don't have a good answer for this, other than, again, prioritizing the needs as a health system. Because if a health system deems that a need is significant enough, then it will invest in finding a solution.
And shifting resources, I can imagine, because maybe we're putting too much money in this bucket when we need to change things up. I'm curious, as I hear you talk about this and getting that buy-in from the community and also demanding that seat at the table, how do you do that? Those kind of sound like things pie in the sky, but how do you really get that input? Is that through town hall meetings? Do you send out surveys to the community? What do you suggest?
Yeah, that's an excellent question, and this will be different from one community to another. But we have to be part of the community, and we have to actively listen to our number one. I'm a physician. I see patients in clinic. I should be actively listening to my patients. I believe that it all starts from this. If we actively and with humbleness, if we listen to our patients, we will hear the issues. The problem comes from everything that's been expected by clinicians when there's really not enough time. Time is the only finite resource that we have. Everything else is abundant. Time is finite. And we do need time to directly interact with our communities. Surveys are helpful, and we can do that. But I don't think that anything replaces the real-time, face-to-face, feet-on-the-ground interaction with our communities. And again, there's different hubs in each community. There's churches, there's centers for youth or centers for older ages. There's schools. I think that's the opportunity for all of us to come together and define our priorities and needs.
Yeah, I love that. So give me an example, stay on the positive, when we look at how implementing AI led to a patient success story specifically.
Before moving to Seattle, I was practicing in Birmingham at University of Alabama at Birmingham. And what we had done there is we were using AI in our everyday practice. And the way we were using it is we had partnered with a third-party company. And that company's job was to analyze the data that was included in every single one of our echocardiographic reports. Echocardiograms are ultrasound tests of the heart. And there's numbers and text that go into that report. And our algorithms were analyzing this data in real time. And whenever we would detect certain subtypes of cardiac disease, we would automatically send a notification to the clinician that had ordered that test to let them know that, hey, your patient was found to have this disease, and this is what you can do to help them get further management by our specialists here at UAB. Wow. And there were more than one instances where we found out that a patient ended up getting life-saving intervention within a month, whereas when we looked at our data beforehand, it would take an average of up to, and this is very embarrassing, it would take an average of up to 200 days. Wow. And after we started implementing this AI algorithm, the time to appropriate life-saving, because this is life-threatening disease that we were detecting, life-saving intervention, the time that it took was less than 60 days. And not just that, but looking at aggregates, when we looked at our African American patients versus our white patients, before implementing that algorithm, we saw that there was a huge gap in the time that it took our African American patients to get appropriate care compared to the white patients. And after we started using this algorithm, it's a very powerful graph that shows the two lines for this being time, this being African Americans, this being whites. So much, much shorter time for whites versus African Americans. And once we started using that algorithm, you can see the two lines starting to overlap. So both of them saw, both for whites and for blacks, we saw an improvement in the time. The time got shorter for both of them. But it was 3 or 4 times improvement for our African American patients.
And that's what you're talking about, equity. You know, it allowed for that. Did that mean that the physicians changed behavior, or what happened? So
that's a great question. First of all, this is retrospective data. It's not prospective. It wasn't randomized, prospectively collected data. There is a prospective study. After we saw these results, we said to ourselves, okay, we have to answer the question, is this the cause, or is this just a bystander effect that we're seeing? But it happened. We observed it. Like, there's no question it happened. One of the things that I think meant and uncovered was our own unconscious bias. And I'm sorry, I'm taking some time to think about it because it's very moving to me. Because I would never think that as a physician, I would treat any person differently. Right. But the data paints a different picture.
Yeah, and that's why it's unconscious, right? Yeah, because you have no idea you're doing it. So that's a way to let the data support.
Exactly. And again, we're humans. None of us means for that. None of us wakes up in the morning, no doctor wakes up in the morning or clinician thinking to themselves, how am I going to deliver differential care for different subgroups of people today? No one does that. That's where the machine can help us, and that's why we started off by talking about collaborative intelligence and not artificial intelligence. It's assistive, it's collaborative. We can use it and leverage it to help us uncover our blind spots and our unconscious biases and help us make things right. I feel like with the COVID pandemic that catalyzed this AI explosion in healthcare specifically, it's like we're given a second chance to make things right. And it's in our hands to have a seat at the table, bring the community in, bring the patients themselves and their families and caregivers in, have them have a seat at the table, and change the entire culture of what we consider medicine and what we consider being a clinician.
Yeah, it's an opportunity to get it right.
Yes.
All right, so last question for you. How do you see the use of AI evolving in the cardiology space? You know, let's look, I don't know, I always say like 10 years down the line, but I think this moves so fast that we could say 5 or 3 years down the line.
Yes, yeah. I think at the core of it will be a change in our culture and a change in the way we practice cardiology. So instead of being reactive and instead of reacting to disease after it happens and trying to detect disease and manage disease, I think the big difference is going to be that our role is going to be more proactive by using data analytics from large data set. And I'm not just talking about labs and EKGs and echocardiograms. I'm talking about genomic data, radiomics data, data from EHR, data that patients themselves are generating from their watches and mobile apps. Using AI to integrate all of this data and make appropriate management decisions to not really treat disease, because that's not going to be the success. The success and the victory is going to be at predicting disease before it even happens. So the real change will be from us being disease managers to being health promoters. I think that's going to be the main difference. And then we can look at all of the subsets of cardiology, from imaging to interventions, to electrophysiology procedures and arrhythmia detection and arrhythmia prevention and prediction that we can do from a single EKG lead from your smartwatch now. And this will all allow us to change what our perception is to be a doctor. It will be to promote health, not to treat disease.
It's a great conversation. Thank you so much. We started, I feel like, in darkness and we're ending in light. Thank you so much.
Thank you so much.
For that very
Thank
insightful
you.
conversation.
Thank you.